Part of the Senate deal to end the shutdown included a mid-December vote on the Obamacare tax credits. But it remains to be seen exactly what the Senate will even be voting on, and there's absolutely no expectation the House will take any action on healthcare. Meanwhile, in the House, Minority Leader Hakeem Jeffries is trying to force a vote on the 3-year extension of those subsidies, a proposal which Republican Congressman Don Bacon said on this show is, quote, dead on arrival. For their part, Republicans have spent years talking about repealing and replacing Obamacare, but they've yet to come up with their own plan. And the clock is ticking, with open enrollment already underway and premiums set to double on average, according to analysts. Joining me now is NBC News Capitol Hill correspondent Mel Zanona, who's been working around the clock on this and other issues. Mel, the government is open, but is there any urgency now to address this healthcare issue that this fight was all about? Is there any desire to negotiate after the shutdown?
So I will say there is a sense of urgency, and that's for 2 reasons. Number one, those Obamacare tax credits are expiring at the end of this year, which means if those lapse, millions of Americans are going to see their premiums skyrocket, including in many red states. And number two, another thing you mentioned, Democrats are going to get a floor vote in the Senate in December on an ACA bill of their choosing. And so Republicans really have a choice here. They can vote with Democrats to extend those subsidies, which risks angering President Donald Trump, or they can vote against the bill, but that risks angering voters ahead of the next midterm elections. And so what we're seeing is that Republicans are now scrambling to try to come up with some alternative so that they don't have to support those Obamacare subsidies. Because in reality, most Republicans do not want to see an extension of those tax credits, even with reform, something that is being talked about amongst Republicans and some Democrats. But this is a really tricky issue, and they're essentially starting from scratch. And so the clock is ticking, and I think the likelihood that they're able to come up with and pass a plan before the end of this year is just really unlikely.
The idea that they're starting from scratch as though any of this is a surprise is striking to me. President Trump's got an idea. He keeps talking about giving money directly to Americans to pay for healthcare. Is there any kind of policy scaffolding around that? Is that getting any traction among Republicans on Capitol Hill?
It actually is getting some traction. We've seen both members in the House and Senate start to craft versions of that, FSAs, HSAs, the idea being that instead of funneling money towards those subsidies for insurers, instead funnel that money towards a health savings account, essentially putting money in people's pockets so that they can choose their own health insurance plans. Sounds simple, right? But we actually talked to some health experts who said under that scenario, there is a risk that the entire ACA marketplace collapses, and then you put people with pre-existing conditions at risk. Of course, that was one of the chief provisions of the Obamacare Act, and when Republicans tried to repeal it, they got so much backlash because of that very popular provision. And so, yes, there are some ideas floating around, but just how viable those solutions are, that remains to be seen.
Well, you talk about the attempted repeal in the minute or so we have left. How much does the bad taste in Republicans' mouth from the 2017 effort still kind of loom over this whole conversation?
I think it looms large. I was talking to Jeff Van Drew. He's a Republican from New Jersey. He said the definition of insanity is doing the same thing over and over again and expecting a different result. And he's worried that's going to be the case with this new effort to try to find a fix for Obamacare. Even Speaker Mike Johnson says he has PTSD from the last time they tried to do this. I will say, though, that, and Garrett, you would know this, it seems like President Trump is more interested in finding some sort of solution. He's quipped about calling it Trump care. But as you know, that is so much easier said than done, as Trump and Republicans saw in 2017.
Yeah, healthcare is really hard. Also, wasn't Jeff Van Drew still a Democrat in 2017? We'll have to
he was, and he was part of that 2018 wave that benefited from the backlash to the efforts to repeal and replace Obamacare.
See, there's a through line all through it. Mel's